I I fell on the stairs in my house, and I don't know how to say it. I have a backache like 6 years ago. So I went in. I was in hospital, but they recommended the surgery. So I don't do it because it's dangerous. So and I saw your videos. So that's why I'm coming here.
Okay, so we're doing this instrumentation to look for is there any abnormalities in temperature. And this helps isolate the particular level we need to focus on. And we found something right at this level. So since this happened 6 years ago, this is not going to be a recent thing. Not like when you just recently sprained your ankle. What does the ankle do? Swells up like a balloon. Well, since this happened 6 years ago, obviously there was no huge swelling like that. What the body does instead is there's long-term swelling, chronic type of swelling, and that's what we're looking for. So this fellow over here, what also makes it hard is the fact that he's skinny. So go ahead, stand up for me. Stand up, stand up. Okay, now we can see it. So now we can see the swelling over here. Should be smooth like this, and it gets fluid all around this area over here. This right here, this is all chronic, long-standing fluid. So we're going to take a closer look, see what's going on. Have a seat. By the way, for the students and the recent docs, that's something you should be consider as well. Skinny patients, okay. The funny thing is the edema is not as present when they're sitting down, but very prominent when they're standing up. Right? So now let's go ahead and test it. Also, he mentioned on the history, because there's a little language barrier over here. He also mentioned about sciatica going down the left leg. So now we're going to confirm what particular areas is causing the sciatica. Okay, so how is this fellow over here? Pain?
No, not much.
No. How about here?
Yeah, that's not much, but I feel.
Okay, does it go down the leg?
No, that's.
No. Okay. What about this one?
Yeah, that's a little more.
A little more. And then this one.
Yeah, that's the pain.
That's the pain. Going down the legs?
No, I don't feel it.
Let's try again. How's that one?
That one, yeah.
Yeah.
That's the pain.
That's the pain. I understand that. But does that go down the legs?
Yeah.
It does. All right. So now we found a spot. So that's the second sacral segment, right there. Okay. Not the fourth, not the fifth, not even the first, but it's the second sacral segment right over here. Produced the most pain for him and duplicated that left sciatica. So let's go ahead. Let's take a closer look on the films. This is your MRI. See all these white things over here?
Yeah.
That's normal.
No.
See all this darkness over here?
Yeah.
That's damaged. So according to the MRI, and we see with this over here, see this back part?
Yeah.
It's bulging out. It's sticking out more than these other ones. These are normal. That's fine. This is abnormal. It's sticking out. So these two discs are damaged. And the medical doctors, the surgeons may have explained, okay, this fellow we may have to operate on. Okay? But we just tested on you. Number 4, no pain.
Nothing, yeah.
Number 5, we tested.
Yeah.
There's no pain either. Okay. But when we test, the first one over here, first sacral segment, it says, oh, there's some pain there, but doesn't duplicate your sciatica. But when we go with number 2, it says, oh, a lot of pain and duplicates that left sciatica. So you see this over here?
Yeah.
You have a rudimentary disc over there. The sacrum is supposed to be one bone. Let's see, you're 25 years old right now. Okay.
Yeah.
So this is the last bone to fuse in the human body. Because when we're first born, it comes out in 5 pieces and eventually merges to one bone around 30 to 35 years old. Sometimes as early as 27.
Okay.
Right? You still have these rudimentary pieces.
Okay.
And this one is due to trauma.
Okay.
Right. So as we see over here, because of this rudimentary disc, and we did everything what we do to confirm it, instrumentation confirms there's a problem at that level. We tested it, produced the pain at that level and duplicated the sciatica. MRI confirms it. Even this X-ray over here, what we see, there's a little bubble in the back. We have an open wedge over here. This second sacral segment is in trouble. This is the one we need to correct on you.
Okay.
Let's roll. Just draw out the belly. Just relaxes even more. There you go. A little more. Take a moment. Breathe. I know it's a very deep correction. When you're ready, come on up. Okay, go ahead. Walk back and forward. No, don't walk too far. Walk this way. Just keep on walking this way.
I don't know. I'm feeling well.
Yeah? What's different about it?
I'm feeling well. Feeling better.
Good. How's the pain going down the legs?
No, I'm feeling better. Good. I can do that. Before I don't feel like, don't say, I don't know, like pain, but now,
Mm-hmm.
I don't know, I'm feeling better.
Good.
Mm-hmm.
All right.
Yeah.
Anything else?
Well, that's it.
All right. That's everything, brother.
Okay.
We're all finished.
Thank you so much.
Oh, you're very welcome.